Hi, I'm Michael Owens, producer of the Healthcare Facility Summit taking place here at the Arizona Biltmore. One of the most important issues today in healthcare is, of course, healthcare reform. Is it a good thing? Is it a bad thing? Is it something that we needed? But most importantly to the people attending this conference is really how is it going to impact their organization? So we went to them and asked them what they think.
Healthcare reform is something that's been needed for a while. As we know, the system's been broke, costs have been escalating, and so something needed to be done.
I think there's a need for healthcare reform. I'm not sure that what they've done has addressed where the need really is.
It's unbelievably complicated the way it is today, so there is some necessary needs to simplify it, if you will. The question is the new reform going to make things simpler or more complex? And usually when the government gets involved, things tend to be more complicated. So the big question for us today is healthcare reform is necessary, but how will it manifest itself between now and 2014?
We have a huge number of people who are uninsured. So certainly in terms of integrating the whole system, making everything available to everybody, I think that a common form of health insurance is critical to us as a hospital to continue to provide the kind of care.
As it turns out, everybody who wanted health care, I think, got health care, but they just got it in a more expensive way. If you needed to go to a doctor and you don't have a health care insurance card, you went to the emergency room. So rather than the visit costing a $20 copay, it cost the hospital a couple of $100.
It's kind of nationally recognized we're about 40,000 primary care physicians short right now. So the first person that everybody should have a primary care physician you see first before you go see some type of specialist. If we're 40,000 short now and they add 30 million people to the rolls, the numbers don't match. I mean, you just can't take on that kind of responsibility. And unfortunately, primary care physicians are the lowest paid of the physicians pretty much. I mean, there's a few types of physicians that get paid less. So there's not a great incentive for doctors to be primary care physicians.
We treat a number of uninsured patients in our hospital, and we have to absorb those costs. We're not reimbursed for many of those costs. So certainly there is a need, a market for the uninsured everywhere in the United States, and I think if you look at the rest of the world, we're behind.
Healthcare reform will have an impact on facilities capital planning. Fundamentally, we have to be more conscious of how we spend every dollar. We got to make the right investment.
I think probably the biggest issue for us is that the concept of a bundled service with a single payment mechanism to cover a service that includes all of your lab tests, your doctors, and your hospitals is going to be a big challenge for university healthcare systems where the physicians are not employed or in the business system of the hospital.
The metaphor I like to use with my staff is like a big water balloon, and somebody is now squeezing that water balloon at the top, and it's forcing the water down to the bottom.
Well, I think one of the big impacts is going to be consolidation in the marketplace. I think we're going to see less hospitals, and as a result, or hospitals that are standalone hospitals becoming part of systems.
So I don't think the federal government has any real idea as to how healthcare reform is going to play itself out over the next 5 or 10 years. But they do know that if they keep pressing from the top and saying there's less money, less money, less money, the hospitals and the doctors who are the recipients of that money will figure out how to deliver good clinical care in a less expensive environment.
I think it's going to affect BJC. We're going to see the same flood initially that everybody else is going to see. It may lead to delays. It may lead to, like some of the other systems in either Canada or Europe, where you have a wait. So it's a 2 or 3 week wait to see your doctor.
But how it will affect design and construction and facility building is that it's going to make the environment more competitive and more difficult. I would say that we're thinking there'll be more consolidations of facilities to take advantage of some cost savings that economy of scale and efficiency of scale bring.
I just had my shoulder replaced in February. I called the doctor, told him it was time. We talked. 2 weeks later, I had my surgery replaced. In Europe, it's a 6 to 8 month wait to get a surgery replacement, shoulder replacement, or a knee replacement. So, right now it doesn't look good, and I'm not sure what's going to fix it. So, but I think we're kind of waiting for that other shoe to drop on the funding part of it.
If we want to reform healthcare, keep it simple, have an individual accountability and responsibility for healthcare, have some kind of tort reform that limits some certain liabilities to the cost of healthcare delivery, and really just have the whole access to people to have a seamless process of healthcare delivery versus the cumbersomeness it is now, and how it potentially become more cumbersome for future healthcare recipients.